Imagine walking into a doctor's office in the 1880s. You're exhausted, anxious, maybe in pain. The doctor listens carefully, nods, and then prescribes cocaine. Not as a last resort. Not as an experiment. As trusted medicine. Bottles of cocaine tonic sit proudly on pharmacy shelves. Surgeons praise it as a miracle drug. Scientists call it the future of healthcare. But what started as one of medicine's greatest discoveries would soon become one of its most dangerous mistakes. The story doesn't begin in Europe or America. It begins high in the Andes Mountains. For thousands of years, indigenous South American communities chewed coca leaves to survive brutal mountain conditions. The leaves helped suppress hunger, reduce fatigue, and fight altitude sickness. Spanish explorers noticed workers using coca to endure long labor hours. Fascinated, European scientists eventually transported the plant across the ocean. By the mid-1800s, chemists successfully isolated cocaine from coca leaves, unknowingly unlocking a substance far more powerful than anyone expected. When cocaine entered European laboratories, it quickly gained fame. Doctors believed they had discovered a cure for exhaustion, depression, and chronic pain. Pharmaceutical companies rushed to produce cocaine-infused wines, syrups, and even chocolates. One popular tonic, Vin Mariani, was endorsed by celebrities and global leaders. Cocaine wasn't hidden, it was advertised proudly. To Victorian society, it represented modern science and medical progress. But beneath the excitement, early warning signs of addiction quietly began appearing. Among cocaine's strongest supporters was a young neurologist named Sigmund Freud. Long before founding psychoanalysis, Freud believed cocaine could cure depression and treat opioid addiction. He wrote research papers praising its benefits and personally experimented with it. Freud encouraged friends and patients to try the drug, convinced it would revolutionize mental health treatment. But as cases of addiction surfaced, Freud's reputation faced scrutiny. His support of cocaine became one of the most controversial mistakes in psychiatric history. Despite growing concerns, cocaine made one groundbreaking contribution. In 1884, Austrian eye doctor Karl Kohler discovered cocaine could numb the eye without putting patients to sleep. For the first time, surgeons could perform delicate operations safely while patients remained awake. This discovery transformed surgery forever. Cocaine soon became widely used in dentistry and minor operations. It marked the birth of local anesthesia, one of medicine's most important innovations. By the early 1900s, doctors could no longer ignore the truth. Patients developed severe addiction, paranoia, and heart complications. Hospitals began reporting disturbing psychological symptoms linked to cocaine treatments. Even healthcare professionals became dependent after repeated exposure. What was once called a miracle drug was now recognized as a public health threat. Medical journals shifted from praise to urgent warnings, marking one of the fastest reputation collapses in pharmaceutical history. As addiction spread, governments introduced strict drug laws. In 1914, the United States passed the Harrison Narcotics Act, restricting cocaine sales and requiring prescriptions. Similar laws soon appeared worldwide. Cocaine transformed overnight, from respected medicine to controlled narcotic. These regulations laid the foundation for modern pharmaceutical safety laws and changed how society viewed medical drug testing forever. Even today, cocaine's medical history continues to influence healthcare. Scientists used its anesthetic properties to develop safer alternatives like lidocaine and novocaine. These drugs revolutionized surgery and dentistry while eliminating many addiction risks. Cocaine itself is still occasionally used in rare medical procedures under strict supervision. Its story reminds us that scientific breakthroughs can carry hidden dangers, and progress often comes through painful lessons. The history of cocaine in medicine reveals how quickly science can shift from miracle to mistake. It teaches us the importance of long-term research, ethical testing, and patient safety. As new medical innovations continue to emerge, this forgotten chapter reminds us that every breakthrough carries responsibility. Sometimes, the most dangerous drugs begin as the most promising cures. Thanks for watching. Please like and subscribe to our channel and get 1000 years of good luck.